By way of background, it's increasingly recognized that distress and burnout are major issues in modern medicine, especially for physicians. The drivers of this distress are understood to be diverse. They include things like work efficiency and interference between work and home roles. But a key driver is a sense of community and a shared sense of purpose in the workplace. Community is just absolutely crucial. This shared experience of feeling like you're working together with people around you for a common purpose is just central to a sense of meaning in the work that we do. I'm Colin West. I'm a professor of medicine, medical education, and biostatistics at Mayo Clinic in Rochester, Minnesota, in the divisions of general internal medicine and clinical trials and biostatistics. And we have a paper upcoming in Mayo Clinic Proceedings titled Colleagues Meeting to Promote and Sustain Satisfaction, COMPASS, Groups for Physician Wellbeing, a randomized clinical trial. And I'm delighted to have the opportunity to say a few words about this manuscript. A number of years ago, we published a study on facilitated small groups of physicians who would get together on a regular basis and share their experiences around a variety of issues that were common to physician work lives. In this current report, we've updated this to be a somewhat more flexible, scalable model, looking at small groups that do not require a formal facilitator and can occur at times that the group decides itself that it's going to meet to discuss issues relevant to the physician experience. So in this trial, we recruited internal medicine physicians in Rochester, Minnesota, in a randomized study where the intervention arm participated in what are called COMPASS groups, which stands for Colleagues Meeting to Promote and Sustain Satisfaction. What they committed to was meeting every other week with a group of 6 to 8 colleagues, where they would spend the first 15 minutes or so of their session in dedicated discussion around a topic that was selected from a menu by the group. They could then use the rest of their hour together to talk about anything that they chose to. So they could continue with the topic at hand, which is, in fact, what most groups ended up doing once the discussion got going, or they could simply enjoy the time together and build that sense of community. The control group continued for the first 6 months with their normal standard practices around their work and personal lives. In the second 6 months of this study, the control group had the opportunity to form and participate in their own COMPASS groups if they wished. We assessed a variety of outcomes over the 6 months of the intervention and again for 6 months afterward, including burnout, depressive symptoms, quality of life, meaning in work, and likelihood of leaving one's job in the next 2 years. We focused on these outcomes because we know that burnout has implications for every stakeholder in medicine. And so for physicians themselves, we're looking to reduce burnout, improve depressive symptoms, build a sense of community. But we also know that burnout is related to job turnover, for example, which affects access for patients and is very expensive for healthcare systems. As far as the infrastructure for setting up the groups, we do have institutionally an internal website. It's peg.mayo.edu. And we have an administrative partner who has helped us set up an automated online intake. And so groups can self-form, or we can have individuals that can submit their name and say, hey, I'm interested in this. I don't have a group of 6 or 7 colleagues, or I actually want to meet an entirely new group of people. And we have an administrative assistant that has done an outstanding job in recent years working with our employee well-being group at Mayo to help facilitate bringing people together in almost a matchmaking function. What they're committing to is 6 months of meetings. Many of those groups will continue. We have other groups that see this as a way to circulate among different teams. And they, after 6 months, will say, okay, let's break us up and we'll reform with different people. So after the 6 months, we assessed these outcomes. The results of the study were quite positive. And what we found was that burnout rates in the intervention group were reduced by 13 or 14 absolute percentage points. We saw an improvement in likelihood of leaving one's current job, approaching 10% in improvement, and similar improvements in depressive symptoms. These results are important because they give us one more tool to help address burnout and distress for healthcare professionals in a way that models a shared investment between the organization, which in this study funded the meals that our participants had during their meetings, and the investment by the individuals who are making time to share their experiences and themselves with their colleagues during these meetings. And this is a key element of moving strategies forward to help promote well-being for our healthcare professionals so that everyone feels that they're engaged in helping our physicians work more toward thriving and flourishing and less toward burnout, disengagement, depressive symptoms, or even leaving the profession or leaving their work roles, which are all outcomes we'd like to avoid. After the study was over, we, based on the study results prior to publication, we gained approval from institutional leadership to have this become available for all physicians and scientists across the entire Mayo enterprise. And so the groups that were involved in the study itself, many of them did continue. And to date, since the study was completed, more than 2,000 physicians and scientists across Mayo have participated in at least one round of 6-month series of groups. That's about 40% of all of the eligible participants, which I think is striking because we are asking people to make some time to be able to participate in these groups. And they're seeing that the benefit of building that community makes it worth it for them. In terms of potential next steps for this kind of work, this so far has just been focused on physicians and scientists, but the underlying principles are relevant to really any other group of healthcare professionals. And so next steps for this from an institutional standpoint will include exploring these kinds of community building efforts for people outside of the physician and scientist group. And also, as medicine is such a team-based activity, thinking about groups that may be interdisciplinary. And can we bring those teams together to enhance their team functioning, their well-being as a group, as a work unit, breaking down the silos across job roles. If you'd like to learn more about this study or the Compass groups themselves, I invite you to read the article at the Mayo Clinic Proceedings website. And also feel free to contact me at the contact information provided in the manuscript itself.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.